Welcome to Grace Hospital. Today we'll be telling you about what you can expect if you're having a colonoscopy. We hope that this video will help you prepare and reduce any concerns that you may have. Having a colonoscopy means that we use a camera to examine your bowel to diagnose a problem or to provide treatment. You may have been referred by your specialist because of symptoms that could indicate a health problem. In this case, a colonoscopy allows the specialist to gain a much clearer picture of the health of your bowel. In many cases, treatment is relatively simple and can be undertaken at the same time. If more complex treatment is required, you may be referred for further treatment. Colonoscopy is an outpatient service, which means that you'll be in and out of hospital on the same day. At Grace, they are performed at the Operative Centre, our dedicated day-stay unit, which is adjacent to the main hospital. The Operative Centre includes a specialist endoscopy facility which meets the highest international standards and has been designed specifically with your comfort in mind. When you're having a colonoscopy, it's important that you have a clean bowel. Several days before the procedure, you'll be given very clear instructions on what preparations you need to take and when to do so. Please follow these instructions carefully, as this step is crucial to achieving the best outcome from your procedure. And if you're unclear about anything, please call our nurse to clarify. On the day of your appointment, please bring a list of any medicines that you're taking, including prescription medicines, homeopathic remedies, or any other drugs purchased from a pharmacy. When you arrive, come directly to the Operative Centre rather than going to the Grace Hospital entrance. There's plenty of free parking, and we encourage you to bring a friend or family member to support you as you check in and prepare for your procedure. A nurse will talk you through what's going to happen, discuss your health history and take observations such as blood pressure and pulse. And this is a good time to ask any last-minute questions or discuss any concerns about the procedure. We'll also insert an IV through which we will administer any medication that you require. At this stage, your specialist will meet with you and will ask you to sign a consent form which gives your agreement to the procedure. You'll be given a mild sedative through your IV to make the procedure as comfortable as possible. This will make you feel relaxed and sleepy. Some patients chat with the specialist and nurses throughout the procedure, whilst others sleep right through it. Having a colonoscopy involves a small tube which contains a tiny camera inserted through your anus into your bowel. When the tube is in place, the specialist views the images on a screen positioned nearby. These images assist him in making an accurate diagnosis and, where appropriate, undertaking treatment. The process takes place in a darkened room, which improves the clarity of the image. During the procedure, your consultant may take small pieces of tissue, called biopsies, and these are sent for microscopic examination. Another procedure that can be carried out is a polypectomy. Polyps are small outgrowths of tissue within the bowel, which can be linked to bowel cancer and can usually be removed safely and completely during the procedure. Following the procedure, you'll be taken to our recovery area and carefully monitored by our nurses. Your procedure at Grace will take 3 to 4 hours overall. We'll give your support person a call when you're ready to have visitors. They can join you as you have something to eat and relax for a while. Your nurse will talk you through any ongoing care and tell you what you should do if you feel unwell or have any complications, although this is very unusual. And remember, because of the sedative, you won't be able to drive for 12 hours. It's very important that you arrange transportation home. We also recommend that an adult stays over for the first night to keep you company and to make sure you're comfortable and feeling okay. Your specialist will discuss your procedure with you before you go home. It's a good idea to have someone with you during this discussion, as often the effects of sedation could cause you to have difficulty remembering the conversation. We perform hundreds of colonoscopies here at Grace, and our focus is on doing everything we can to make your experience as relaxed and stress-free as possible. The majority of our patients go through the process with no difficulty at all. But if you have any concerns or questions, please do ask. We'll be very happy to help.